And when should she come with her child the first time to the dentist and things like that? Tell us a little bit about it.
Well, for a new mother, enjoy your baby, and try and see a dentist by the time that the child is, say, 2 or 3 years old. The only time that we really see any real issues with young children and their teeth and decay is if they have what's called baby bottle syndrome. It's where you put the baby to bed at night, perhaps with their formula or some sort of juice in their mouth, and this juice or milk is flowing over their teeth over many, many, many hours, and it causes horrible decay. I don't think that mothers need to be particularly concerned about seeing their dentist at an age any younger than that. If there's something significant going on, their physician will pick it up immediately on the child and make an appropriate referral to a dentist. Most mothers, what they do is they bring the child along with them on one of their dental visits to get them used to the office, get used to the dentist, get used to the surroundings, let the child go for a ride up and down in the chair, maybe on mommy's lap, and see to it that they become comfortable in this environment, and they go home with a toy or a balloon, and then they want to come back again. And at that first visit, sometimes all we can do is just take the briefest little peek, make sure everything's okay, and then proceed from there. So avoid the baby bottle syndrome if you can, and other than that, enjoy your child, and we'll see you when you're about 2 or 3.
Great. Now, you shed a little bit of light on kind of the importance of maintaining the baby teeth, because some of us think, well, look, they're coming out anyway. What's the big deal? Why repair it? Just put it or let it fall out in itself. What's the story about that?
Well, the importance above and beyond simple function for baby teeth is to maintain the position for the permanent teeth. If we lose one or more baby teeth prematurely, then the bite frequently collapses, and there's no room for the permanent tooth to come in. And then the tooth will come in sideways, crooked, twisted, and braces may be necessary. Or if braces would have been necessary anyways, this would have made the orthodontic case that much more difficult and costly to treat. So maintaining the baby teeth is important.
I see.
For many reasons, obviously. So
it looks like almost with everything else, an ounce of prevention is worth a pound of cure.
At least, absolutely. At least, yes.
So if we count it in dollar, then that few dollars of maintaining that whole thing is going to prevent perhaps thousands of dollars of ortho. And if not totally prevent it, it doesn't make it as long. Well, all right. So basically, it's not really in terms of brushing. Should the mom help the kid brushing? Do it herself, or just let the kid go about it from young age, whichever way he does it? What's the deal there?
At first, you're probably going to need to brush your child's teeth, because obviously they won't have any understanding as to how to do it or why they're doing it. And do your best to instruct the child and teach them in a fun and playful way as to how to brush their teeth. And in time, they'll learn to do it on their own. But in the meantime, you're going to need to do that for them initially, completely, and then teach them slowly until they learn how to do it themselves. If you leave it up to their own devices, obviously it'll never get done.
All right. Well, thank you very much, Dr. Michaels.